Arizona's stay-at-home order expiring tomorrow as we continue to find the data driving those decisions is incomplete. The state adding more than 500 confirmed cases to a total of nearly 12,700 and 30 more deaths reported, bringing the total to 624. And that is only the deaths we know about. Last week, the ABC 15 investigators revealed data showing the true number of deaths was likely much higher. Now, a nationally respected Harvard doctor and researcher is backing us up. He believes Arizona likely has more than 500 additional COVID-19 deaths just from March and April. The doctor spoke exclusively with ABC 15 investigator Dave Biscoming.
Now, just a quick refresher into our investigation. We used data from the CDC to show how Arizona has hundreds of excess deaths compared to past years. Now, experts told us our analysis was solid, telling. And it's also important to remember that the data we got isn't secret. It's accessible to everyone, even our state leaders.
ABC 15 investigating hidden COVID-19 deaths, and they've uncovered data showing the true number of uncounted deaths could be significantly higher.
Based on our past reporting into excess deaths, Dr. Jeremy Faust tweeted this out Thursday, tagging us. Are states undercounting COVID-19? It appears so. Arizona says 624, but I ran the numbers from the CDC, and there were 1,166 more deaths between March 1st and April 25th than last year. Those more than 500 unexplained deaths, mostly COVID-19.
500 more or so than you've reported from COVID. These excess deaths, that most of them are really coming from COVID-19.
Dr. Faust is a teacher at Harvard Med School, an emergency physician at Brigham and Women's Hospital, and editor for the American College of Emergency Physicians. And again, he believes that during an 8-week period from the beginning of March into late April, there were hundreds of uncounted deaths from COVID-19 in Arizona.
Very few of them are coming from other places. People have theorized, there's deaths from missed opportunity to get care because people are afraid to go to the hospital, and so they're not getting their cancer treatment or they're having heart attacks. We know that eventually could add up, but as of now, it has not in a serious way. And in fact, things like motor vehicle collisions all around the country are far lower.
Faust used predictive data from the CDC. To understand it, about 20% of death data trickles in, weeks, sometimes months late, so the CDC adjusts for that percentage.
If I'm breaking this down to my viewers, when we look back at this in another 2 months, this is where we believe the data will end up.
Correct.
In Faust's analysis matches our own. Also using CDC numbers, ABC 15 data analyst Garrett Archer ID'd a category of deaths with a huge unexplained spike.
It literally jumps off the chart.
Yes.
It's an other general catch-all category of deaths for abnormal symptoms, signs, and findings. Basically deaths not easily explained. It's 157% above normal.
There's nothing to explain this chart except for a classification of COVID-19 deaths.
Arizona's been behind almost every state in testing, especially at the beginning of the pandemic. So outside experts who looked at our data predicted that once more COVID-19 testing increased here, the COVID deaths would eat into that spike. And this chart shows that's exactly what happened once COVID-19 got its own death category 1 month ago. Bottom line, data shows Arizona has hundreds and hundreds of excess deaths compared to last year. Experts say the reason is obvious.
Again, I believe that a big piece of that pie chart is going to fall to COVID.
I'm investigator Dave Biscoming, ABC 15, Arizona.